this happens within our communities and society, and it creates a focus on public health in a way that, and a conversation about public health that hasn't been there in the past. How do you see, and I think you kind of led into this a little bit earlier, but how will this now affect how we talk about public health moving forward?
Like, I think public health before the pandemic started with, it was not such a popular deal, right? Like people will usually go in there if they actually want to help their community or want to like study epidemiology or summer diseases. But after the pandemic, I feel that the topic of public health is just gonna explode, because like after what happened, I feel that most of the people they are willing to go to public health just to try to avoid what happened here.
Yeah, and you can see how public health can, there's so many effects of it, where we talk a lot about like the supply chain being all wonky now too, and still not corrected. And that affects the economics of everything, and everything's kind of interrelated. It's interesting. And it's not over yet either.
It's not over. It's not over. Definitely not. But I mean, as I said, people are starting to take it a little bit more lightly,
Yeah.
Even me, to be honest, like sometimes I feel like I don't want to wear my mask. I don't wear it. Like I just wear it when I'm in class, to be honest. Or if in like a really confined space, I'll actually put it on. But otherwise, it's like,
we have the only place in Chicago that people wear masks or it's mandated is the CTA. And I would say probably about 75% of people abide by the rules. And it's not enforced. And I think that's another thing too, is like the enforcement has been like, it's like there's a mandate, but then also it's like almost impossible to enforce. And then like, at what level are you enforcing it, right? Like I was working at a restaurant this whole time, and we enforce it as much as we can, but also like there's only so much you can do in a way, right? But yeah, I think people it's a pretty good number. I would say like 75%. If people just take an extra precaution on the train, it's not too big of a deal. I don't think people are too concerned about that. It's an interesting time.
Yeah, but as I said, like hopefully people take more awareness after this pandemic, and for the next pandemic, like I hope people actually like take a look back into COVID and be like, okay, we actually screw up here. Like we need to actually make things right this time.